Well, the ill-defined percentage is quite low, I should say, which is very promising. The only issue that we have is our numbers are so small at present to really be able to say that these are the top 10 causes of death. Well, the country did know that it is going through a transition into non-communicable diseases, and this proved it. Well, ischemic heart disease is the number one cause of death. Cerebrovascular diseases is also among the top 10, and diabetes is extremely high, and this goes on to prove that the transition that Solomon Islands is going through from communicable diseases to non-communicable diseases. And in fact, it also shows the triple burden of disease that Solomon Islands is currently faced with. We have a high burden of non-communicable disease, while we are still having also malaria as a communicable disease, and also having injuries. So yeah, this tells the policymakers a lot. So the health system of the country has always revolved around controlling and in the control of communicable diseases, but now here's a shift. Now they will have to also start investing more in preventing non-communicable diseases, and it gives us all the evidence that is required to make this shift. So now we have a technical mortality working group which is very active. They started soon after this initiative. They've taken on the responsibility of really rolling verbal autopsies out, in improving CRVS across the country, and they're really excited about the findings so far. And this is headed by the Undersecretary for Healthcare, Dr. Greg Gillini himself, and it comprises of senior clinicians in the hospital, and they've been very involved in this process of late, and it looks to be very promising.